Getting to a doctor in rural North Carolina could get easier, all thanks to a $50 billion federal investment. All 50 states will receive funding over the next 5 years. The initiative, it's part of the president's plan, Working Families Tax Cuts legislation. It's aimed to strengthen and even modernize health care in rural communities. WCT's Ariana Bertolotti is taking a closer look at this for us today. Ariana, what is the money intended to do?
Daniela, the funding will expand access to care, it'll strengthen the rural healthcare workforce, and it will modernize facilities and technology. Health and Human Services Secretary Robert F. Kennedy Jr. says rural Americans will now have affordable health care close to home. CMS Administrator Dr. Mehmet Oz says states are stepping forward with bold plans to improve rural health. This includes expanding emergency services, training more healthcare workers, and investing in telehealth. In a statement, Governor Josh Stein said in part, quote, North Carolina has long been a leader in advancing rural healthcare solutions, and we are excited about how this new program can support innovations to help make rural communities healthier, end quote. Similarly, Senator Ted Budd released a statement saying in part, quote, the program will greatly benefit patients across our state. While I was proud to support the inclusion of this funding in the Working Americans Families Tax Cut Act, it is unfortunate that the state's application was not appropriately coordinated with the federal officials and did not request funding levels that more accurately correlate with our significant rural population, end quote. We're still working to find out exactly when the funding will be released to North Carolina. We will keep you updated as we learn more. Ariana Bertolotti, WECT News.